And good evening. Good evening to everyone. I see that we're having people join us slowly, and we are on Life with Val D YouTube and Life with Val D on Facebook. So feel free to join us and invite your friends and family as we get started to have this very, very important conversation. I want you all to lean in and listen carefully. And also, we're going to take time to actually hear some of your questions. So I'm going to wait a few seconds before we start. I have some people that I need you to tell me where you are from in the chat, if you will. Tell me where you're from in the chat. Let's see here. Okay. I know we had somebody from Mississippi, Falls Church, Virginia. Yes. Alexandria, Virginia. Virginia in the house. Awesome. 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 Let me double check to be sure that we're on in Facebook. I normally have a crew of people, but my crew has gotten so busy and popular that we've not been able to get together. So hopefully it will actually be a positive experience for everyone. Still have a few more people. Let me get all these technical difficulties out of the way so that we can get through this. Abington, Maryland. All right. Abingdon, Maryland. All right. Good, good, good. All right. Let's see. So this is my first time in a long time doing this. So I'm glad we are back. South Bend, Indiana. All right. Is that you, Dr. Laura? Outlaw? Sounds like it to me. Sounds like it to me. All right. All right. So those people that are just joining, are you joining from Facebook or are you joining from Life with Val D, the YouTube channel? Okay, I can't tell. Oh, they're on YouTube. Oh, awesome. Awesome. On YouTube. Okay, awesome, awesome, awesome. Very good. Very, very good. All right. All right. So we're going to go ahead and get started, and hopefully we can get through this and you have a positive experience. First of all, good evening to everyone. I am Valerie D. Johnson. I am an author. I am a life design catalyst. I am a music educator, professional singer, professor, and I have the pleasure of being your host tonight. In 2019, I wrote a book called Wow, I Needed to Know That: The Manual for Embracing a Powerful Life Without Limits. The show was developed as a result of that. There were so many things that I felt like people didn't know, some things that I just didn't know. And so this book was about a conversation needed amongst young people, older people, doesn't matter. And so the show is a continuation of that. And what I'll be doing is having guests on who will talk about various walks of life, things in life that we need to know. And tonight is one of our big conversations about our bodies. And so the mission of the show is to empower and to inspire listeners while providing essential information needed to navigate one's journey. The show is sure to have the audience saying, "Wow, I needed to know that." So if you have that moment, type that in the chat for me. Again, I ask that you would like and share, invite your friends to this wonderful conversation and this needed conversation. I'd like to introduce our guest and jump right into the conversation. I first like to introduce Dr. Lauren Outlaw, born and raised in South Bend, Indiana. Dr. Outlaw desired to provide care internationally, which led her to joining the International Medical Humanitarian Organization. Many of you may be familiar with Doctors Without Borders, for which she served as a medical officer in South Sudan. She also worked in Thailand and later on moved to Northern Virginia, and now is on staff at the University of Maryland Charles Regional Medical Group, and her office is in La Plata, Maryland. Dr. Outlaw, I'll let you take a second to add on to that if there's anything else, and welcome.
Hi, thank you for having me. I'm very excited to be here this evening. I'm also working on opening my own GYN only weight management practice, and that'll be back in Falls Church at the end of the summer, beginning of the fall. So stay tuned. It's going to be called Lifelong Wellness and Gynecology.
Awesome. All right. Moving forward, Dr. Banga is a board certified osteopathic OBGYN and fellow of the American College of Osteopathic Obstetricians and Gynecologists. She is a native of Ghana, West Africa. She's been in the US since probably 1997. She is a best-selling author. She's an award-winning physician and blogger. She has served on boards and is often guest speaker at both national and international conferences, colleges, religious events. She discusses topics from puberty to menopause. And boy, do we need that conversation. Currently, she is in private practice at Greensboro OBGYN Associates. So welcome to both of you. Thank you for joining us tonight.
Thank you for having us.
Yes, we are in for a treat. So again, call your friends, your mom, your daughter, your auntie, your sister friend, your cousin. Just get them on so that they can hear this very needed conversation. There are alarming statistics related to the health of African American women. Some are being misdiagnosed and losing their lives because of it. Some of you may be aware of them. Others suffer and do not realize that they have a problem. Do you know of someone who has had female issues and the doctor was not addressing the issue? Perhaps you lost a friend or family member to cervical, ovarian, or breast cancer. Tonight, our OBGYN specialists will discuss commonly asked questions and help us to become better advocates for ourselves. And again, I know many of you that are listening, including myself, have experienced people that seemingly didn't get the right diagnosis, or the second diagnosis was the one that actually led them to their prognosis and treatment or not. So tonight, I just want to talk about it. When we have pains, people say, I have heavy cycles and kind of ignore it. Or I have this pain here and, oh, I'll just take something, or it's just gas. So we start to talk about what's going on with our bodies, but sometimes we don't follow up, or we don't know that, hey, you may want to get that checked out. So hopefully tonight you'll gain some knowledge that will help you better navigate your health. So let's start out. Well, just talking about and I'll give you both an opportunity to talk about, what do you see as the problem? What do you see are problems? And then what can we do? And when should we do those things that will best help us? So let's start with what first. What do you see some of the problems, some of the things that you're seeing in your practices? Dr. Outlaw, I'll start with you.
So as far as problems with women not being able to get access to health, I think is a big issue. that I see in my practice. And I've worked in the DMV area for about the last 9 to 10 years, part of the time in Falls Church, part in Southern Maryland. And regardless of which area I've been in, there's always an issue with one, either women feel like they haven't heard, two, they didn't know where to start, three, they're kind of just told this is normal, or four, being embarrassed. I see that a lot, that women are afraid to speak up for themselves or to voice their concerns or their problems, or the right questions aren't being asked. So no one's ever said to them, are you having this problem? Are you leaking urine? Are, common things that women may experience after childbirth. And I think I uniformly hear, nobody told me about this. As I've gotten older, I have a lot of patients who are in menopause and perimenopause. And the uniform thing I say is, nobody ever talked to me about this. No, my mother never talked to me about this. My sisters, my girlfriends, we don't talk about it. And so giving people the strength that it's okay to talk about these things. Our bodies a lot of time are seen as taboo or things you shouldn't discuss, or that's, especially in the African-American community, those are things talked about inside and behind closed doors. So just feeling comfortable to have these open dialogues and communications with people who look like you, who don't look like you, or the same gender or not, I think can really empower people.
Yeah, that's excellent. And I'll say I'm one of those people. My mom didn't really, have any issues with, she didn't go through menopause, and my aunts really didn't go through it. And, I know one of them just said she just never really had any symptoms. And so I started feeling things. I'm like, wait, what is that?
Like so a light switch.
Dr. Bang, I give you the floor on that one. What is the issue? What are the issues?
I think I agree with what Dr. Lauren said. It's about creating a space where people feel comfortable to be able to ask the questions that they either think they should already have answers to, and so they're embarrassed to ask at any point in time. My view of the relationship between a patient and a physician is, this is a collaborative interaction.
Mm-hmm.
I may have some information, but I might not know what information is pertinent to you. And you may have some questions, but if you don't ask them, then I don't know how to address them. So think of it as a partnership.
Yes.
Whenever you have a meeting with a physician, first of all, yes, you do have to be comfortable to be able to speak. So sort of gauge that space, gauge what your personal boundaries are,
Mm-hmm.
and how comfortable you are speaking to this person, and how in tune they seem to be with addressing your needs as well.
Mm-hmm.
One of the things that I try to do with every visit is, at the end of it, say, is there anything else you wanted us to talk about that we haven't addressed yet? Now, that could be a little bit of a slippery slope because some people could go ahead and just go into 500 different things, and so sometimes that can be a trigger to, okay, maybe next time when you come in, we can talk about that. And, just have some understanding that we might be able to talk about all of it. But I do think that we as physicians do need to create that safe space for you to be able to bring up things that we may not have brought about in the conversation, but also on the patient side of things. Know that when you're coming in to us, we may not intuitively know some of the things that may have bothered you, what your knowledge base is, what concerns or fears that you have, what questions you have. So it's a time for us to come together, to collaborate, to come up with an outcome that will best serve you. It's all about you in that room and your needs.
And I think that's the important part. Sometimes I think we don't know what to ask or what to talk about. Like, well, I know I have that pain, but is that important? And it sounds like what both of you are saying is, just say it, because it may be important. And so
Right.
not to hold back things. So when you're there, just explain what's happening. Someone told me a long time ago, you really should write things down before you go to the doctor. And then that way you don't have to make yourself remember, what's going on.
Okay. That's something I bring up with my OB patients a lot. Sometimes at the end of the visit, I'll be like, okay, well, everybody has a cell phone, everybody has a note section.
Mm-hmm.
So if something between now and next time, write it down. And that was more so before we had health systems where you can send me messages to the portal asking questions in between. Sometimes that's great, sometimes not so much. depending on the type of question. But a lot of times I try to tell people, write it down because you're going to forget, or bring an extra set of ears, because sometimes that can be helpful too. But it needs to be a set that's okay with hearing what we're going to talk about.
Right. Good. Okay, so let's move on to when. At what point do we need to come to the doctor? Let's say we've already had our routine visit. Well, first of all, we need to start having routine visits.
Yes.
Don't. So you can address that, and so those of us that have our regular visits, but maybe we have some kind of pain. At what point is it necessary to come in? Like, what's a gauge if we're having, let's say, a heavy cycle? At what point is it necessary?
So I try to tell people, you don't have to suffer. Like, you can have, sometimes heavy cycles may be normal for you, but that's not normal on the larger spectrum of things. And you don't have to live with it if you don't want to. There are options, whether it be medication, whether it be dietary changes, whether it be surgery. There's a gamut of things in our toolbox that we have to help you. And I personally know I've had horrific cycles since I was a child. So, and I kind of dealt with them and went to the doctor and stuff like that. And then when I got to med school and residency, I started learning all these things. And it's like, oh, I don't have to live like this if I don't want to. And, so I think that helps me be able to relate. Just because something is normal for you doesn't mean it has to be normal. And then just to go back to the annual exam, because we've changed the frequency of pap smears for women, a lot of times people think they don't need to come to the doctor, or somebody like, oh, well, they told me I didn't need another pap for 5 years, so I haven't been since then. You still need to come every year because some things can change, some things can come up in between that time period. And if I don't see you for 3 to 5 years, I'm not gonna catch it in enough time. So I still feel like, even though I might not do a pap smear every year, I still want to see your beautiful face every year.
Right.
So I'm a big proponent of the more time you spend taking care of yourself, the better you're going to be able to take care of everyone around you.
Right.
And as women, we tend to be nurturers, right? So we're taking care of everybody around us and putting ourselves on the back burner. One practice that I implemented personally to make sure that I was taking care of myself is my treat to myself every year on my birthday is I line up all my doctor's visits. So the week of my birthday, I'm going to every single, I'm going to my primary care doctor, my OBGYN, to make sure that I'm checking in to make sure that I can make it to the next year. Right. That's also a way for me to remember to get my mammogram in, to get my, to get all the things checked off. But preventative care is probably the best advice that I could give to most people. We don't always have to go to the doctor only when we don't feel well. If we go when we feel well, so we have a baseline of what our statistics are when we're not in pain, when we're not having heavy bleeding and all of that. When those things do happen, then we know that it's a deviation from the norm. And your physician knows that as well too. And so then they can implement some interventions. Because, for example, if I've never met you before and the first time I meet you, you say, well, I had a heavy period last month. Okay, was that the first time you ever had one? How long has it taken? There's a lot of history that we have to go through to try to dig through and figure out where the problem started from, how to address it, what other things could have caused it, lifestyle, other medications, surgeries. There's a lot that we'll have to dig through. But if we already have established some time together where I know your history and all of that, when these things happen that are outside of the norm, then we're able to catch it much quicker. So I think keeping up with your routine visits, especially when you feel well, does help to eventually tailor a plan when you don't feel well that can actually be implemented quicker.
Right.
Can I piggyback on that? The other thing is, like, an OBGYN is a different type of specialty because we're not just surgeons or obstetricians who just take care of patients when they're pregnant. We're also people who will see patients throughout a lifetime. So it's also a primary care kind of specialty as well. And so I have so many patients that I haven't seen for a year, but because I know them and have seen them over a few years, I can walk into a room and tell when something's off with them. And so being able to build that type of relationship with your physician helps you be able to advocate when something's wrong as well, because they know you. And you know, when I went to college and came back to Indiana, I went back to the same doctors I grew up with. I went back to the same dentist, because they know me. I was comfortable, and that's kind of why I got into medicine. I like forging those type of relationships with patients, and it helps us be able to take better care of you.
Very good, very good, very good. Well, I just want to bring up a couple things that, again, some experiences I've had, and I've been thrown off by it, which is why I really wanted to do this show. And that is knowing people who went to the doctor and said, I am having pelvic pain, and it being brushed off. And then months later, they are no longer with us. So for me, that's scary. So talk to us lay people, if you will, about how do we manage that? How do we manage when we do see a doctor and we're like, I don't know, or maybe maybe we're like, okay, well, maybe, I mean, they're the doctor. So tell us how do we navigate that? Because sometimes people are afraid they will offend if they get a second opinion.
Right.
And so just talk I'd like for both of you to address that.
You can go first.
Well, I think, and I'm talking specifically to the question that you asked, people who went and they expressed a concern, and then I'm getting the impression that you're saying it was ignored, and then it turned out to be something that was life-threatening.
Yes.
And then they died. Well, that's an awful shame. There are certain things that should be sort of red flags to any physician. If you came to see me and you were already in menopause and you told me, well, I had some bleeding, that right there warrants some in-depth workup. Because once you go through menopause, you should never bleed. You should never have any vaginal bleeding again. So in that case, that automatically should alert me to, are there some abnormal cells going on inside this uterus? We need to biopsy it. Do we need a scan? What we need to do. That being said, I have had patients who have also sometimes thought, oh, well, I was in menopause for a bit, but I got my period again. And so they might not bring that up in that term that it was a period. So right there, we may have a missed opportunity for me to intervene. So I think, again, it boils down to the conversation, the conversation between the two of us. I agree very wholeheartedly with what you said initially. When you're coming in, if possible, write down 3 things that are your top things that are bothersome to you.
Yeah.
And make sure you get answers to those before you leave the appointment. If you need to write down those answers that were said, do so. And at the end of the meeting, at the end of the visit, say, so just so I understand about my concern with this, you think I should do this. About my concern with this, you think I should do that. Just so that you understand the plan that is in place. Because sometimes we may not be speaking the same language. I may be thinking that I'm telling you something, you may be hearing it differently, or you may be telling me something and I may be hearing it differently. Ultimately, we're all human, right? We are sometimes a little tuned to listening for certain keywords, but patients are not tuned to giving us those keywords. So we might miss something sometimes, but make sure that when you come in with your questions, you're not leaving until you get a specific answer or a plan that is in place for you to understand. And if you leave before you walk out the door and you're like, wait a minute, so what are we doing about my concern? Send a message.
Yes.
That's the advantage of those portal messages. You can call the office, you can send a message in and say, I didn't quite understand what the plan was. Could you send me a message and let me understand what the plan is? What are the next steps?
Right.
That way you keep us accountable as well.
That's good. That's good. Dr. Otwell?
So a couple things. First, I think to piggyback on Dr. Banga, also everybody has access to their charts now. So I have patients that can read their notes and get their notes before they walk out of the office if I sign them on. So most of the time, if you go to that area that's assessment and plan, it have what your plan is in it. And if what your question was isn't addressed in that, then maybe your provider didn't hear you. So that's one thing also that you can do to kind of help reiterate some of the things that were said that are missed. I most of my notes I write how I speak so that people can understand them now. So that's one thing. And then the other thing is, if you feel like you're not being heard, being at the gynecologist is already vulnerable. I try to make it a little bit lighter because you're sitting there as a woman half naked in a room with people who have on all their clothes that you may or may not have met before. Where else do you go where you are half naked with people who are fully clothed around you? So you're already vulnerable and uncomfortable. So that's number one. And it's hard to be open about how you're feeling or what's going on. If you feel like you bring up a concern that is not addressed, like she said, you either send a message, you ask another question, and if you don't get the answer that seems reasonable to you, go get a second opinion. I know I am a special type of person. I may not always be everybody's cup of tea. So I tell people, if you're not comfortable with me, I'm not offended. I'm not too big in my britches to say, hey, you need to, if you're not comfortable with this plan, I would prefer you to seek care somewhere else as opposed to not seek care at all. That's what I care most about, is that women are taken care of, whether that's me, whether that's one of my partners. If I don't know something, I ask questions. And like, I have had surgery. I went to 3 different surgeons before I chose someone, you know?
Wow.
And so, and I know doctors. So that in itself tells you, you have to be comfortable with the person that's taking care of you. If you are not, please don't ignore it. I tell people every year, you need to do a monthly breast exam because you know your body better than I do. You know your body, you've lived on it all 20 to 60, 70 years of your life. So if you feel like something is off and it hasn't been evaluated to at least prove it's not off, then go somewhere else to find someone that will evaluate it and that you're comfortable with. If you're not comfortable with the provider to share it, you need to find someone you're comfortable with. I'd rather anyone do that as opposed to ignore it, because too much is at stake.
Yeah. And so it sounds like the common denominator here is we really need to be aggressive about our own health. That, like you said, if you don't feel comfortable, if the doctor is saying something that you're not comfortable with, then you need to go. Like, don't sit back and be like, oh, well, and I think sometimes people are just too nonchalant about it versus being aggressive about it.
So I don't know if aggressive the word. I feel like aggressive has a negative connotation, especially when we use it in the form of women, right? A man can be aggressive and it's seen with respect and authority. Women, it's given this negative connotation. You need to be an advocate for yourself.
Right.
You need to give yourself a voice, and we need to stand up for ourselves. And and I think, I was talking to someone the other day and she's concerned about saying something in a certain way because how it's going to be viewed regarding her healthcare. And she didn't want the doctors to look at her negatively. And I'm like, but this is important to you. So if this is important to you, like, most people aren't going to come off aggressive because you're not aggressive anyways. So that shouldn't even be a fear. Unless you're walking into my office, cussing me out, we're all good, So most people, that's not your natural tendency. You shouldn't be afraid of it, and you shouldn't be afraid of standing up for yourself. Yeah.
Right. And it's
not seen as aggressive, it's seen as advocating for yourself, which we should all do.
Absolutely. And so when I use the term aggressive, I'm talking about in the way we think about like our healthcare, like, I'm just kind of lay back. And so I think that's one thing. The other thing that I think this is reminding me of is, here we are with people who would like to have a second opinion, but they don't have the money to do it. Do you know of resources that could help, or what should we do? What are the action plans that we could take as a result of, okay, I want a second opinion, really can't afford a second opinion?
So if people have insurance, I always say, and this is what I do personally, go to your insurance website. It will always have a list of providers that are accepted, and you may have to pay a copay, but a copay is cheaper than chemo or radiation or surgery. So, and I understand, I have worked with people, I have volunteered in places where people are choosing between their medications and eating that night. So I understand that is a issue. If that's the case, go to the health department. A lot of times people view Planned Parenthood as it only provides certain procedures, but they do well women exams. They have doctors there who are volunteering to provide healthcare services for people that don't include procedures that get people up in arms. So, and it's going to be at a greatly discounted price. So those are some of the resources that we have that people just aren't aware of. But like I said, the health department's a great place to start. Sometimes some churches, if you are religious, will have resources for people. A lot of times hospitals will have financial sliding scales some places. So those are the things you might have to do a little bit more legwork, but it's worth it.
Good. Dr. Banga?
Yeah, I agree. Those are probably all the places that I would have recommended as well. Certainly starting with your insurance and the plans that are the providers that are covered under that would probably be um, the least expensive option under your insurance plan. But I mean, if you don't have any, I worked in an area at one point when I was in Ohio where my practice was the only all women practice in town, so there weren't really many resources around there. So in places like that, you may have to come out of pocket a little bit to go to maybe a different city or a different town to find a different physician. Um, to give a second opinion. But there are definitely a lot of resources out in a lot of different communities, such as Planned Parenthood, that can also be helpful.
Yeah. So ladies, I hope you're taking all of this in and, share it. I know even I teach at a university, and some of the college kids, say I haven't had an exam because I don't have money and that kind of thing. I think this is helpful though, because they do have at least that resource. And sometimes on university campuses, there's a doctor there, and then they can lead you as to where you should go and what you should do. But don't ignore it because you don't have the money. At least begin to seek out what you think you need, or speak to people that may have the resources that you need. All right, that's good. That's good. That's good. Okay, so we talked about the what, we talked about when. How do we go about when we have a prognosis, when we know what's going on in our diagnosis within our bodies? What are some of the tools that we should be aware of to help us get through those moments? I know several people who've had breast cancer, and they had to look for sources. One knew where the resources were. Someone had ovarian cancer, and they needed a support system. So I know there's a lot of things that we are not aware of that we need to be aware of in terms of how we navigate the healing process.
One thing I would say that I know I personally need to do a better job of is informing people of a lot of groups for ovarian. There are a lot of groups for ovarian cancer and breast cancer, like the Susan G. Komen run and so if you go to their websites, there's an ovarian cancer society as well. If you go to their websites, you'll be able to find resources that may be linked to your area with support groups. I've had friends who have had other health problems, and I recommend them going to Facebook and looking for, and you have to do your due diligence because of the internet being the internet, but you'll be able to find support groups for lots of different health problems. If you have a church, a lot of times they can be a good resource as well. And then your provider. And a lot of cancer centers will have some type of counseling or mental health that can help link you up with support groups too, to help make it like a navigator. And, unfortunately, healthcare has changed so much over the last several years. And so a lot of hospitals have let go of some of their social workers and things like that. But that also can be a resource if your hospital has a social worker or a case manager that may be aware of some resources.
Good.
And one other option, especially when you mentioned breast cancer, is one of the things that the national organizations do an amazing job of is they have so many activities during that month of October where they, for example, the hospital system that I work for usually will organize a run. And they even did this during the pandemic where it was virtual. Go to these healthcare events, these health fair events, and they'll have them for different things. Breast cancer is probably one of the bigger ones that they'll usually have. But at these places, there's usually several different booths where they have several different physician offices. They have support groups. They have options for free mammograms and things. They have a lot of and information and support system information that they might pass out at these health fairs that might be beneficial. Some that some of us, the physicians, might also be learning about for the first time there. There is a downside to a lot of to social media sometimes, but there's a lot of positives, and some of the positives are word of mouth, where people will share information about places that they get resources from. So certainly using social media for that, and doing your due diligence, like Dr. Lauren said, before just trusting, especially if it's coming from people that you don't necessarily know. Just do your due diligence on looking up those places and the reviews, and check it out for yourself as well too.
Good. So Dr. Banger, I know that you deal with puberty. And so can you talk with us and inform the parents and the audience, what are some of the things they need to be aware of, that they need to know as they navigate the puberty years of their daughter?
Oh, you're speaking to my heart right now. I love the puberty years. I am a firm believer that if we start off just getting to know our bodies ourselves, that centers us, that gives us a sense of security in who we are. That's one less thing for us to wonder about in this big confusing world that there is out there,
Right.
And the earlier we get our young women comfortable with what's normal for them, what to expect, the changes their bodies are going to go through. And if they can anticipate it, then they can mentally prepare for it. You can prepare for it together. So I really think it's important for us to break the habit of considering certain changes that the female body goes through as taboo to talk about. You know,
Right.
if you don't start using proper terminology with your daughters about what a vagina is, and somebody attacks them in that area against their will, and they're using tricky words like, oh, he touched me in my, funny place. Sometimes teasing out the language there becomes a problem. Have them be able to use the proper terminology. Have them know that their body's going to go through certain changes. I think probably one of the most traumatic thing for a young girl is to have her first period when she did not know that her body's going to go through that. And to have that happen in a public place, usually the elementary years, that would be just traumatic, if you really think about it. So prepare them for this, and giving them this information is not harming them in any way. It's a natural transition that every single female is going to go through. And so just we educate them in school so that they know what to expect in life. We need to educate our young ladies about their bodies as well. And if you as a parent caregiver don't feel like you have the terminology, you have the word, the verbiage to be able to go through that conversation with them, find a physician, a provider, somebody that you're comfortable with talking to your young person about that change, and treat it as an interview process. Go and meet them yourself first. And then if you're comfortable with it, then bring your young patient, your young lady there to meet them as well, and have that conversation about those changes that they're going to expect, and let them know that it's beautiful and wonderful, and to embrace it.
That's good. I think that's something that a lot of parents just need to know. Like I have friends whom their parents never talked to them about it. So like you said, they learned in the street. You're gonna learn somewhere. So, and that's not what you want. So I think that's very important. So let's just hit on a little bit about the maternity and how African American women are suffering in that area. Dr. Outlaw, I'll let you speak to that in terms of what's going on. I've read some of the statistics in terms of, childbirth and death in birth and all of that. So give us a little bit about that, and anything that you want to warn us about or inform us about?
So I think the biggest thing, because I am someone who has practiced all over the world, I've been blessed to practice all over the world, and seeing how unfortunate it is that our numbers are a lot higher in the United States, and even some of these other countries that I have been to that don't have the same access to resources. I think a lot of it, or some of it, comes from one, not knowing how to advocate for ourselves. Two, if you don't feel comfortable not with the provider you're with making a change or asking for a change. In some situations that's not possible, but I think as a healthcare society, we have to do better at hearing our patients when they are saying or trying to explain what's going on, especially since they don't necessarily always have the words. And not just on the level of the physician, but on the level of the nursing staff or the tech who's drawing the blood and paying attention to patients. I think women, we need to do a good job of paying attention to our bodies as well when things feel off or are changing. And being a voice, and then whoever your support person is, if that's your mother, your husband, your wife, whatever your support person is, them being an advocate for you as well. I think that's going to be the first step. If you feel like something is wrong, go back to the doctor, go back to the emergency room. I normally recommend try not to hop around from place to place as far as ERs, because they're not going to have access to your records. And I try to explain to people, if you show up on my doorstep and I haven't taken care of you, it's like reading the last page of a book. I have no context as to what's gone on before. And that makes it difficult for me to take good care of you. But the biggest thing is when you know something is wrong, to say something. I think if you live in DMV, it says see something, say something. If you know something's wrong, say something. And not just as the patient, the nurse, the doctor. I've had nurses, pull me to the side before, and I feel like I've also had to say something to nurses before, because sometimes people don't see the humanity in us. And that's where problems come into play. Yeah. And so you really have to advocate for yourself. You can't ignore it. Like I said earlier, you know yourself better than anyone else.
Right. Is there something in particular, while we have so many African-American women dying in childbirth, is there something particular that we need to be watching out for?
So I think as far as, and one of the reasons I kind of got into weight management at this point in my career is because the area I work in now is in a smaller area in Maryland. And I was seeing a lot of people who look like me, who are a lot younger than me, who have awful hypertension. They have awful, obese. They suffer from obesity. They suffer from high cholesterol in young ages. And it's because you're in a food desert. It's because of socioeconomic differences in some situations. It's because of social stressors that other races don't have to deal with the United States. And that puts us at higher risk for blood pressure issues. If we're overweight, it puts us at higher risk for obesity. So what got me into weight was saying, okay, well, maybe if I start making an impact on people before they get I can start lowering some of the risk for people who look like me. So one thing is, if you have access to birth control, use it if you're not healthy at that point in time. But if you have multiple comorbidities, meaning I have high blood pressure, I have diabetes or sugar or whatever you want to call it, I know I'm overweight. Maybe instead of, having a child at that point in time, take another 5 or 6 months to try to lower your blood pressure better, get on meds that are better. Because the thing that we will never be able to change is our race. We will never be able to change how people see us. So what we have to do is do our best due diligence to make ourselves as healthy as we can, so we're not going into a situation where we already might be a step behind. And I tell patients that. I said, you will not be able to change your race. So we have to work on these other things that we can maybe improve upon, because there's a genetic aspect as well. It's not always what you eat or how much you exercise. Some people are just born suffer from some of these diseases that they have no control over. But if we change our lifestyles a little bit, that can go a long way when we're trying to care for individuals and when you're trying to have a healthy pregnancy and a healthy outcome.
Dr. Banga?
I love exactly what Dr. Lauren said at the end there, trying to put ourselves in the best position for a great outcome. Pregnancy is a natural phenomenon, but it can be a dangerous course for a lot of people. And, it's beautiful. We're going to get a beautiful baby at the end of it. And what I love about my profession is when things go right, everything is just gorgeous. And 90% of the time it does. But in those few times that it doesn't, and when it disproportionately seems to affect a particular group of people more so than others, regardless of socioeconomic class, then you know that there's something else going on there that needs to be looked at. So yes, there might be a genetic aspect to certain conditions that we may be more predispositioned to, but if we can also work on trying to get ourselves in the best healthy position for this process that's going to draw on every single aspect of our bodies, then that would probably also help. Now, Dr. Lauren mentioned hypertension. It does seem to be one of the more prevalent causes for a lot of the stories that we have heard. There's a reason why hypertension is called the silent killer. It does not always have warning signs. There are some pretty glaring ones that, when they're missed, it's atrocious. But there are some other things that are sometimes not missed. You can go from having normal blood pressures 1 week to having crazy high blood pressures in a day or two. And so keeping up with our prenatal appointments, of course, that's an important part of it. But also voicing out when something doesn't feel right. One of my sayings when I tell people who I think may be a little more predisposition to preeclampsia or, any of the hypertensive comorbidities is, headache, changes in vision, or anything that just doesn't feel right, please call me. If something just doesn't feel right, notify your physician, notify the nurse that's attending to you, notify somebody, your family member, so that they can notify somebody. So yes, I would say that having an advocate with you at your appointments, writing down questions that you have answers to, bringing up any concerns that you've had over the period of time from your last visit till that visit, and making sure that you keep up with all the appointments. That's the most you can do on your end, right? You can do everything you can to put yourself in a healthy condition before you get pregnant and keep up with all these things. And then make sure that you have a physician that you can trust, that you feel listens to you. If you notice that in the beginning of the appointments, they're not listening to me when I'm saying something, change it if you can.
If you can. That's really good. I really appreciate you all sharing that. And I think yet again, a common denominator here is taking care of your health. And I know all of us have had ups and downs. Many of us have had ups and downs with weight loss and weight gain. But I think that we have to teach our children early what it means to take care of the body. Really. I growing up, my mom didn't. I had candy, but it was like at special occasions. And that didn't keep me from gaining weight. But my thought process about eating candy, I don't, I'll eat it, but I don't have to have it. But my point is being sure that we're starting young, teaching them how to, especially the girls, taking care of their bodies. And the boys too, but really taking care of their bodies in preparation for what will happen in the long run. In the long run, I think this is a much needed conversation. There's a lot of things that I'm gaining from this that I'm very appreciative of. But one of the last things I want to talk about is menopause. boy.
Save the best for last.
I saved it for last. I have a lot of friends who are in it, almost in it, all of that. And I won't take the time to tell my story at this moment, but it is a hilarious one. And I wish I would have known some things earlier. So if you will, Dr. Banger, would you start? Just tell us, what do we need to watch out for? Just talk to us about it.
So the average age of menopause in the United States is 51, but that's an average. There are people who will start to transition into menopause, get into the perimenopause ages a couple of years before that. And there's some who will transition after that. It's not something that just happens as a one-time event and then it just happens, you just cross over into it. It's a period of time. It's something that happens over several years for a lot of people, and it can sometimes happen gradually or abruptly. Most of the time it's gradually. There are several things that are pretty classic for menopause: slowing down of the metabolism, hot flashes, night sweats. The slowing down of the metabolism goes along with weight gain, hair thinning, mental fogginess, or forgetfulness, um, mood changes, like, you know, you get a little more irritable than you typically can. And then, of course, the physical things such as the changes in the menstrual cycle. You either start having irregular periods or skipping cycles for periods of time. We don't give you the official title of menopause until you've gone a whole year without a cycle. But in that interim, a lot of things can be happening. And so it's a whole spectrum of things. And there are some very lucky people who don't have any of them at all. And then unfortunately, there's some people who get every single symptom that I just listed.
Yeah. So do you ever complete it like you're done?
You can.
You can? Okay.
You
Okay.
can. I mean, when you say complete it, most people are probably thinking of the more distressing symptoms, such as the hot flashes and the
Mhm.
night sweats.
Yeah.
But yes, you can eventually. It can last for a long time for some people. Some people don't have them at all. And I think I left out vaginal dryness, and
Mm-hmm.
it goes with painful sex, and
Right.
there's a wide spectrum of things. Oh, bone weakening. So menopause comes with a lot of symptoms, and some unfortunately get affected more so than others.
So should we have bone density test at the time that we're going through menopause? Is that necessary?
So
Not
so we know.
yeah,
Oh,
go ahead. No,
so
go ahead.
it also depends on your family history, your personal history. Did you smoke, medications you take, and stuff like that? Normally,
Yeah.
the age that we recommend is around 65 to start them. So after you've been postmenopausal for a while, but that can change if you've had if you've broken a bone in the past. That can change if you have a family history of bone thinning or low bone density. That can change based on your diet. So, like some people are vegans, don't eat dairy, don't eat a lot of calcium, don't take supplements. There might be a risk to have bone thinning. If they've done that for long periods of time, people who smoke, people who have been on steroids. So it's not, medicine is an art, is what we call it, the art of medicine. So you can't fit everybody into the same box. So it really does need to be tailored based on the individual.
Listen.
And one thing I tell people who are menopausal, you'll sometimes start to know trends in your symptoms. So, like some people, if they drink wine or have coffee, they're going to have more hot flashes. And if they don't, or if they eat certain things or do certain things, they're going to notice more symptoms. So then, I have an aunt, she's going to kill me if she's watching. She used to decide, am I going to have a hot flash? Am I going to have a glass of wine? And then that's how you do it.
Right.
But I feel like sometimes seeing those trends can help people navigate the changes that are going on with their body.
That they're going right.
Mhm.
Yeah, and I had a friend tell me that she recognized that when she had sugar in any form, she was absolutely going to have night sweats.
Yeah.
And if she didn't have it, if she didn't have any sugar, she didn't experience that. So that's really good. Again, I think, as we said earlier, sometimes people just don't have the information because they never grew up around people who had it. So we're going to take the time to take some questions, and then we'll wrap up. So it looks like we have a question here. Can diabetes exacerbate menopause issues?
Well, I think you maybe sort of hit on that already right now.
Okay.
Yes, some people will notice that when they have foods that are high in glycemic index or high sugary products, it can make their hot flashes a lot worse. So if you have diabetes and you have it basically is implying that you have some sort of imbalance with your body breaking down glucose. So that can sometimes make your symptoms a little seem like they're a little worse or be a little worse.
Okay.
And if you have some of the metabolic syndromes that go along with that, that also is going to affect your ability to lose or gain weight, which a lot of times as we get older as women with the decrease in our estrogen, things stick a lot differently. I tell people in my 20s, I eat whatever I want. In my 30s, I had to exercise to eat what I want. In my 40s, I can't eat what I want and I have to exercise to look how I want. So, you know, that it changes throughout our life as
Right.
women. We have to be mindful of that.
Gotcha. Someone says, Janet says, can you recommend any medication supplements that help with these symptoms? And I believe she's speaking of the menopausal symptoms.
I guess that depends on the specific symptom that you're discussing. I mean, we talked about the bone loss earlier, so certainly calcium and vitamin D would be good supplements for those. For I don't know that there's a specific supplement that can fix all of the symptoms.
Yeah.
There's no supplement, for example, that can fix the irregular cycles per se. There's no supplement that can fix the mental fogginess per se, but you might have to sort of time your sleep. Make sure you're getting enough hours of sleep because that kind of triggers into your day the next day and makes you a little less irritable, or because a good night's sleep will help with that. Of course, if you have some bladder weakness that's going along with all of that, that's keeping you up at night, you might need to do some bladder training, is what we call it, where you either do not drink any fluids a few hours before bedtime, maybe 1 or 2 hours before bedtime, or make sure that you void just before you go to bed so you can have a more prolonged, uninterrupted period of sleep. So that's not a specific supplement that I can think of that would fix all of the symptoms. It certainly helps to take a multivitamin. Usually I would say multivitamins that are for women age 50 or older will usually have a lot of the different supplements that you have. And some of that also is dependent on your own diet and what you are getting naturally from food as well.
For me,
she said hot flashes and weight gain were the things that she was speaking of.
So
Go
for
ahead.
me, for weight gain, I normally recommend one, you need to make sure you're in okay health, meaning you don't have high blood pressure, you don't have any problems that if you started to exercise or change your diet or eat differently, it's going to affect your overall health. So if you are not healthy and aren't able to exercise or walk a couple blocks without feeling awful, you probably need to see a doctor before you implement any new routines. For like hot flashes, I send people to the Bonafide. They have a lot of different supplements that you can buy online, but they're pretty expensive, unfortunately. Like I said, I tell people if that's not an option for you, keep a diary of what you did, how many hours you ate, what you drank, everything you put in your body. You will start to see trends that'll help. There's a lots of other things that your physicians may or may not recommend. I think the biggest thing is you always have to look at what else you're taking. If you're not, because a lot of these supplements will interact negatively with any medications you may be on. So if you're going to start a supplement to treat these symptoms, you need to talk to your doctor about it first to make sure it's not going to be something that's harmful for you. So I think it's hard in a setting like this to tell someone over the internet, because when I'm talking to my patients, I know what they're on. So I can be like, oh, you can try this, you can try that, and that'll be safe for you. And some supplements act like estrogen. So if you have a high risk for breast cancer and things like that, it may not be the safest thing for you. And then you got to try a little bit more natural pathways in order to treat this.
Good.
Yeah, for hot flashes,
vaginal dryness, though, I always tell people coconut oil, vitamin E suppositories. My office is going to get mad. I'm giving away these pearls for free. Refresh, replens, but you can find a lot of natural oils that are for vaginal dryness. I feel like women are really scared to mention that, but a healthy sex life is important. So.
Yeah. And coconut oil is edible, and so it doesn't need to be wiped off. So, but going back to what Dr. Lauren said about, some of the natural supplements. Yes, for hot flashes, sometimes we'll tell people things like you can switch to soy milk from, calcium. Now, granted, that might be taken away from some of the calcium intake that you may be having if you switch. So none of this is just there's not a band-aid that fixes it all.
Right.
Some of this has to be tailored specifically for you. So that's certainly a conversation that's where that conversation comes into place to come up with a plan with your physician.
Good. All right. Star says, has the average age for the onset of puberty changed?
I wouldn't say it's changed, but I would say it is different for different races of people. A lot of okay, gosh, you're speaking to my heart when you say this, right? So a lot of the average ages are based on studies that were done on Caucasian young females. And that's just the same across the spectrum for a lot of things in medicine. But by and far, we're finding that, for example, Black and brown girls undergo puberty at younger ages than some of our Caucasian colleagues. So the average age seems to be around age 8 to 9 for a lot of Black and brown girls. And when I say that, that doesn't mean that they're getting their periods right there, because the transition into puberty doesn't start just with periods. It starts with some of the body odor changes. It starts with the breast development and all of that. So we are seeing some of those changes as early as that. As to the reason why, I don't know that there's been as much research done in that sphere to dig that out specifically. Could diet have an effect on that? Could genetics have an effect on that? Absolutely. But yes, there are different age categories for different people. And Asian young ladies seem to undergo puberty sometimes a little later than the Caucasian colleagues as well. And that might also have to do with body fat composition and things like that as well.
Okay, very good. All right. Felicia says, is it true you will experience menopause early if you start your menstrual cycle before 12 of age?
Necessarily. I don't agree with that. Not necessarily.
Is that a wise tale? Okay. All right. So Marisol says, if you have an IUD and don't know if you are stopped menstruating, is there a test you can take to determine if you are in menopause?
So I personally don't always trust the checking hormones. I have people that come in all the time asking me, can you check my hormones? And I'm always like, well, what hormone do you want me to check? First of all, and what are we looking for? Because you need to know why you're doing a test. When you have an IUD, especially for women who have horrific periods and again aren't at high risk for progesterone causing cancer, things like that, I say if that IUD is working and making your periods better, ride that thing out to the 8 years, get your money's worth, and then you can take it out and wait maybe a month or so and check your blood work to see if you're in menopause or see if you have a period. But I've had patients that we check their blood work on Monday, it looks like they're in menopause because hormones fluctuate. And then a couple months later, they come in bleeding, they check their blood work, and it doesn't look like it. So you can't always just go by the blood work. The definition is, Dr. Banga said, 12 months without a period, and you're not on hormones or anything that's stopping that period or haven't done anything to stop that period. That technically is the American College of Obstetrics and Gynecology definition of it. So.
Okay.
Yeah.
And I'm in line with Dr. Lauren on the checking hormones.
Nice. Shanice Cox says, shameless plug, inspired by my mentor discussing this topic, I wrote a paper on menopause. She should share that.
There you go.
Is that you, Dr. Big? Is that one of your mentees?
No, she's mine.
Hers, yes.
Okay. What changes can you expect during going into your 30s? Nina asked that question.
I don't know that there are as many changes physically going into the 30s. Let's see. I do seem to, and this is not scientific at all, it does seem like almost every decade, we do have some physical changes in our body and our metabolism that seems to happen. So there might be a little bit of a slowing down of your metabolism as you go into your 30s, same as if when you're going from your 30s to your 40s or 40s to 50s. So there might be that. But usually by that point, physically, you're developmentally at your full capacity. You're probably in the prime years of your fertility. So if there are any underlying structural issues with your uterus, like fibroids, or things like that, you probably would have picked up on those already with your cycles through your 20s if you haven't been on birth control during those periods of time. So I'm really thinking here. So I'll let Dr. Lauren pick this one up, but I can't think of anything else other than metabolically.
I think I agree with you as far as our metabolism. And this is more so, again, from personal experience, not reading a study that, coincides with this, and from my friends, just talking to them about it, your metabolism does slow down. I definitely can tell I responded to food a little bit differently as I went from, I agree, you're kind of in peak condition then, especially before 35, if you're considering having children. When I was going through my early 30s, talking to some of my cousins and my friends, a lot of physicians don't bring up, hey, what are your plans about having children? And if you hadn't thought about it, you might in your early 30s, when I think about, do I want kids? Do I want to freeze my eggs? Do I not want to freeze my eggs? If you're not that you want at that point in time. So those are things I think women in their 30s should start to think about, because you get to 35, I think a man came up with this, you become geriatric in pregnancy. So our advanced maternal age, I call it wise in pregnancy to my patients. But once you get to 35 and older, you do start to take on a little bit more risk. So if those are things you may want for your future, you might want to start having those conversations with your doctors about what this may look like. What should I be thinking about if it's not being brought up to you? So those are things I would recommend thinking about in that age.
And so the geriatric pregnancy, what age is that?
35.
35. Yes.
Wow. Okay. So I'll have one more question. Someone is asking about PCOS. They've heard about this with celebrities. Have you found anything that we need to be aware of in terms of our community?
I think you need a separate session for PCOS.
A whole different beast. That could be a whole hour-long discussion.
Wow.
PCOS is
that and endometriosis.
Yeah. Can you just give us a brief overview, because some people may not even know what it is? What is it?
The biggest piece with PCOS, you're going to have irregular periods. You will maybe go of time without a period at all. Some people will be obese. Some people will be thin. You will maybe have an increase in amount of testosterone. So you may have more acne, more facial hair than some of your fellow colleagues. You also can have metabolic syndromes that go along with that. So you can have cholesterol levels that are off. You are going to be a little bit higher risk for diabetes. Sometimes you can be a higher risk for hypertension. So when you have PCOS, there are a lot of things that are playing there that lead to this one disease process that's kind of stemmed by your ovaries, we'll say. And so really, if you notice you're having irregular periods, meaning you're going for months without a period, and then when you do have them, they're super heavy or long, or maybe they're not. Anytime when you're in a menstruating age and you're not menopausal, you should be having a period on a regular basis. And if it's longer than 3 months, I think you need to see a provider to talk to them about it, because there's other workup that we need to do and things you need to look for.
Wow. Someone says we need a part 2. And I actually agree. And here's why. Much of what has been talked about tonight, many people just don't know. Maybe you think they should know. Well, maybe they don't, including myself. There are things that I have just not been aware of. And so the point of the show is to provide information so that people can best navigate their life in general. So we will look into that and see if we can have another panel discussion at another time. If we do it again, you need to get your girlfriends and have some popcorn and put it on the big screen so we really can dive into this this conversation. I am so grateful and honored that the two of you have accepted my invitation to be on the show and to have this much needed conversation. I don't take it for granted that you've spent your time this hour just sharing with people and helping them to understand how to best navigate their health. If you'd like to put your information in the chat, feel free to do so. You may reach out to Dr. Outlaw. I think I have a number here for her, 301-609-4800. Is that correct?
Yeah, but Google me in the fall. It'll be changing.
Okay. Oh, good news in the
I'm
fall.
going into private practice.
Oh, awesome. Congratulations. Congratulations.
It'll be called Lifelong Wellness and Gynecology. So Google it in September.
Now, is that going to be in Maryland?
It'll be in Falls Church, Virginia.
Falls Church, Virginia. Nice. Very good.
You can ask me all the questions.
Awesome. And then Dr. Banga can be reached at Greensboro OBGYN Associates here in Greensboro, North Carolina, 336-854-8800. Again, ladies, thank you so much for joining us tonight. Audience, I really thank you for being here tonight. I think we had a fluke on Facebook. I'm not sure what happened, but I see that some people have come over to YouTube, which is absolutely wonderful. Thank you for sharing that information. Just a few announcements before we end the show. There will be 2 shows in the month of May, I believe, and we have topics. I have a specialist, a person who is a specialist with Medicaid and Medicare. And I can tell you that a lot of us don't know, we don't know heads or tails about Medicaid or Medicare. In North Carolina, it's been expanded. And so there's some information out there that many of us need. So he's going to come and talk to us about that. I have a financial specialist who's going to talk to us about budgeting and how some of the things that we can do to better stack our cash, for the lack of better word, but to really get our budgets in order. And we also will have someone coming to talk with us about estate planning, because I have found that many people do not have any plans. And if you've ever gone through it, you know that at the point of death and you have to deal with people, with your loved one's business, if it's not in order, it can be a nightmare. So we're going to have someone to come and talk with us about that. One of the big lessons that I learned some years ago was, and this is just a tidbit, that if you have power of attorney over your loved one and they pass away, that power of attorney means absolutely nothing. A lot of people don't know that. I did not know that. So that means that there's information that we all need so that we can be sure that the end of life for all of us, our parents, our own lives, are intact. So those are some of the shows that are going to be coming up really, really soon. And I am excited about this new season with Wow, I Needed to Know That. So if there's nothing else, ladies, do you have any parting words for us? Anything that you'd like to say as we end tonight?
Preventative care is key. And don't be shy to talk to your doctors about anything that's bothering you. If your doctor does not answer it or is embarrassed to answer it, then they're not the right doctor for you. And you can find me on all social media under drbanga.obgyn.com.
Yes. Everybody got that? Let me just put this in the chat. So drbanga.com, right?
drbanga.obgyn.com. Or is that what they say with the handles? It's Dr. Banga OBGYN. Just Dr. Banga OBGYN on all social media. Yes.
Got it. And Dr. Outlaw, give me yours again.
My Instagram is at LGOutlaw6, and you can find me at Dr. Lauren Outlaw on Facebook. You can send me messages if you have questions. And I think the biggest theme I've heard here is just let's be an advocate for ourselves. We have the questions. And then the last thing is we need to normalize our bodies as women, no matter what our race is, and normalize our conversations about our bodies. And we have to be comfortable, and we need to start that with talking to our kids about these things so that one day you're not 60 years old, not able to say vagina, or not knowing what your body looks like or feel like. So we all need to just be comfortable in our bodies.
Absolutely. Absolutely. Tell me your Instagram one more time.
At LG Outlaw 6.
You said L?
LG as in girl, and then Outlaw, like my last name, and then the number 6. And then it's Dr. Lauren Outlaw on Facebook. You're seeing me in a hat sitting on a wall.
Okay. All right, got it. Ladies and gentlemen,
Thank you
so much, and we really appreciate your time, and that's going to wrap it up for us tonight. Thank you for spending a moment of your life with Val D.
Take care, everyone. Thanks for having me.